what were your goals, or what were your sort of problems you were trying to solve, and what you were thinking how this might help?
Sure. So our overall goal when introducing Florence was to capture three different cohorts. We were looking at patients who had uncontrolled hypertension, those who were not compliant with their medication regimen, and those who were titrating either on a new hypertension medication or titrating off.
Why don't we start from the patient standpoint?
Sure. So patients are reporting real ease of access using Florence as a text-based service. They love the fact they don't have apps to download. They don't have to remember logins. That they really enjoy the fact that Florence is saving them time and money from having to come to our office site for blood pressure checks.
Hmm. That's great. So basically, there it's easy for them to use. As that all the folks that you've engaged and enroll in the platform, are they looking at their texts? Are they interacting with Florence?
So we are having 100% patient buy-in. I'm checking on. I'll pop on every morning and look, and patients are diligently doing their blood pressures, getting them in for us, and we're not having, or we haven't experienced any technical difficulties. So
Right. It is pretty easy when you don't have to download an app. Do you have any examples of sort of a clinical situation where Florence was helpful in that decision making?
sure. So I would probably go back to last week. Had a very nervous patient who was seen by the provider, really worried, about their blood pressure. They felt, that it was really out of control. We were seeing pretty consistent numbers here. Um, and we were able to meet with the patient, calibrate their blood pressure cuff, and send them home. And they've been sending in their readings, which are in line with what we were seeing here in the office. And so the patient called me yesterday and just said how relieved she was that, to be able to actually know that Florence was, giving her affirmations, motivations, but that her blood pressures were within the ACO, requirements. So it was a real win for the patient. She's less nervous, and it just allowed her to be at ease at home. It's impacted in a positive way our entire practice. I know that, our team has developed a list of other opportunities that they want, everything from congestive heart failure, the whole diabetes management, all the co-occurring pieces. You're going to be able to, from what we've been able to tell with just our short term on Florence, that it's kind of there's no stopping the ability for what is available, and what we'll be able to see Florence build, that we can access as a program. So we're really excited, just to see what the next programs coming out are going to be.